Hi, a very warm welcome to everyone present over here. I am Akshat Agrawal, group leader of our project MediScript, followed by our team members Apurva Singh Thakur, Abhay Vishwakarma, and Ayushi Dubey. Today, we will be presenting our project MediScript. That's tagline is Your Pharmacy Buddy. It is an online prescription maker for user needs.
So coming on to our problem statement, we aim to make it possible to enter prescription into a software system as quickly as writing them by hand. Many people, including those in pharma industry and even the doctors, often struggle to read handwritten prescription. So our main goal is to digitalize medical prescription and to get rid of handwritten ones altogether. This will make it easier for everyone to understand and follow prescription accurately.
So our aim and objective is to eliminate the issues like mistreatments and deaths caused by misreading and misinterpretation of the drugs that is written by illegal writing of the doctors. So for it, we have proposed a solution that it is entirely eliminating the very traditional handwritten prescriptions, and it will provide a integrated infrastructure for doctors to improve and optimize and manage the prescription process in their uh, medicational practices.
Now, hi, my name is Abhay. So, coming upon to the values of the customs and the impact. Since the prescription mistakes accounts more than 70% of the drug error reports by the hospitals and the general practice settings, we are at the main source of the worry of the healthcare workers worldwide. Although these mistakes condoms result in the death, they can be seriously harm a patient health the healthcare provide, we are forced to alert with the services delay in the strategies as a result of COVID-19, which had a negative influence on our health and the service across the globe. After the COVID-19, the outbreak, e-prescription became a crucial tool for establishing a secure environment and reduce in the person consultancy and the paper prescription handling.
So basically, there are three simple steps to use this R software. First of all, the doctor will create a letterhead, that is, he will register and write the user details in it. Then he will select the drugs and the prescription companies and send it to the database. Then he will directly sign or stamp the prescription digitally and send it to the user. So this is how our software will work in three simple steps.
Hi, I am Ayushi and I will tell you why should you use our services because we have well-planned software, we have simple UI, it is time efficient and we provide 24 into support system and it is futuristic also. There are some benefits of MediScript. Prevent prescription drug error, easily prescription of controlled substance, monitor controlled substance prescription, easily recounsel medication history, meet meaningful use requirement, easily track prescription fulfillment, reduce lost prescriptions. These are some benefits of MediScript.
Now, let me tell you about some great features. So, our standard features cover you can create prescription without needing the internet and then share them as a PDF or print them out. It will help you to quickly fill up in previously prescribed drugs. It keeps a record of all the prescription you have given. Also, you can search for prescription by the patient name. And there are even more useful features. In the Pro license features, we have C analysis. This means you can view the charts that shows the number of prescription over time. Customize PDF, so you can change the look of your PDF to fit your needs. Add watermarks to put your watermarks on the PDF. And there are even more features available with our Pro license feature.
So now I will be telling you about the technology stack that we have used in this project. For making the UI and front-end part of our website, we have used HTML, CSS, and JavaScript. For basic scripting of backend, we have used PHP and Apache. And for storing the data queries and using the database, we have used MySQL. So this is how our website looks like. And this is the code base of our project. Here we have used HTML, CSS, and Tailwind properties to make the basic UI of our software. And this is how the form page looks like. And also, after creating the website, we have this simple UI of the project where the user will directly click on the Get Started button while coming to our website, and he will be facing this UI in which he can write its name, age, weight, height, mobile number, and clinical features that a doctor has given him, investigations and referrals, advices. He can directly submit all these entities and it will directly go to the database and it will store all the things in it. This is how our website will look in the beginning phase. So our website has a very clean UI in which the doctor will come to a software, then he will write the digital prescription and send it to the patient. And he can also select medicine names, manufacturers of the medicines, and also the disease types. This is how our software works.
Okay, so now coming upon to the business model canvas, here are so many of the key entities where, so coming upon to the first one, basically they are out of two. So the first one is the doctor and the second one is the pharmacist. Now coming upon to the doctor will use this app and generating a digital prescription for the patient as well as the structured manner in which is going to be faster in handwritten as prescription. Now coming upon to the pharmacist will provide a medicine and then explain the dosage and explain according to their diagnosed plan by the doctors. Now coming upon to the key activities, the doctor will take care the details of the customer and the plan a diagnose and generate a digital prescription of the patient, and the patient will go to the pharmacist with a digital prescription and get the medicines. Now coming upon to the key resources, there it have the user details, the name of the drug, the detail of the doctors, the detail of the manufacturer of the medicines, and the last one is the detail of the pharmacist shop. Now coming upon to the value of the the propositions. Now the company is providing a prescription with a structured data of a software system which is in the time efficiency. Now coming upon to the core values, the core value of the company is to save the time and digitalize the prescription is organized by the structure manner. It has a very clean UI with a beginner friendly and a time efficient at the same time. Now coming upon to the customer relationship, we act as a company to our customer assessment terms toward our organization prototype of presenting interactive with a customer frequency of customer frequently at 24/7 services through our helpline. Now coming upon to the customer segment, the value proposition targets our company is to save time, privacy of the patient, and record the cost efficient and user friendly. That's all about the model canvas.
Now, I will tell you how we can generate the income of our model. So, coming on to the source of revenue of our model, first we have AdSense. We earn money by displaying ads next to the content on our website. With AdSense, we can show ads that are interesting and relevant to our visitors. We can also make these ads watch the look and feel of our site. When people use our search feature, they will see sponsored result at the top marked as our recommendations. Not only this, for Pro license buyer, we offer extra benefits to user who signs up for our Pro license, which has a monthly fee. This includes special recommendation that are sponsored.
Okay, now coming up onto the use case of this diagram, here there are two entities basically. The first one is the doctor and the pharmacist, and the second one is the patient. Now, the doctor and the doctor will design a patient detail and create a prescription. Now, secondly, this goes to a plain diagnose and then select a medicine. After that, planning a medicine, that will plan a total dose. Now, this all data will goes to a database in a proper structured manner. Now coming upon to the second one, that is the patient. The patient will get explain about his problem and whatever his concern is, and then it will get a prescription with a proper dose.
Now, I will tell you about future scope and objective. In future, the main aim of MediScript is to add various services, mainly a delivery system that delivers the medicines to your doorstep according to the prescription stored in the patient's profile. Volunteering system, we add a people who believe in people for the people philosophy. They will receive help by request patients with their necessary details and live location and hence visit to the patient's house to their help. This is how we sum up future scope and objective.
So thank you so much for the respective dignitaries for listening to us. This is our project MediScript, and we have made this project to help people, and it is a basically a initiative to help them. And through our technology, we have privilege to do all these things. So that's how we will signing off. Thank you so much.